Hello, good morning everyone. The topic of discussion for me is a child abuse. What is child abuse? Child abuse is a physical, sexual, emotional maltreatment of a child or children. According to the Disease Control and Prevention, the CDC and the Department of Children and Families, DCF, defines a child maltreatment as any act or series of acts of commissions or omissions by a parent or other caregiver that results in a harm, potential for harm, or threat to harm a child. The categories of child abuse are number one, the neglect, number two, the physical abuse, which is the most common, psychological and emotional abuse, and not but not the least, the sexual abuse. The child neglect, this is the maltreatment related to failure to provide age appropriate care. This could range from a physical neglect, emotional neglect, medical or dental neglect, and educational neglect. And its neglect can also include inadequate supervision and exposure to the violent environment. The child neglect is the most common with teenage moms and in single parent moms. The main reason for all this is because of the lack of proper financial support. The neglect children often experience difficulties in the psychosocial development. They develop decreased attention, memory, and they prove to very aggressive behaviors. Those children who have difficulty in maintaining relationships in the love and friendship as they lost the trust and attachment in the childhood. Physical abuse. This is a non-accidental injury to a child who sustains in the hands of his or her caregiver, which results in a skeletal injury, burns, bruising, any brain injuries, and many more. There are some pathognomic signs for the physical abuse, which include subdural hematomas, retinal hemorrhages, skeletal injuries, and fractured bones. And all this we put together a syndrome called as battered baby syndrome. The major risk factors for the physical abuse include alcohol, domestic violence, drug abuse, single parent moms, lack of education, poverty. Many people who commit physical abuse were abused themselves as children. The wounded recognize the wounded. The psychological or the emotional abuse. This is the production of psychological defects in a child as a result of the behaviors like yelling, rude attitude, criticism, abusive and demoralizing words. This can result in learned helplessness and overly passive behavior. Sexual abuse. The adult or older adolescent who abuses a child for sexual pleasure. The sexual abuse can range from intimate exposure to the private parts, physical contact with the children's private parts, and many more. These kids suffer from flashbacks, PTSD, post-traumatic disorder, self-esteem issues, suicidal ideations, depressions, and other mental illness like dissociative identity disorders, borderline personality disorders. Most of the victims of sexual abuse are female, and the abusers are mostly the males. Most commonly, the stepfathers. The effects of child abuse. The effects of child abuse can be categorized into the immediate effects and the long-term effects. The immediate effects include like the physical effects and the developmental issues. The long-term effects, the children may develop many psychiatric and psychological problems like PTSD, anxiety, depression, bulimia in females, dissociative symptoms, and dissociative identity disorders. Like each has its own memories, behaviors, and behaves in a different way under the stress, and they're very prone to drug addiction and substance abuse. And the victims of child abuse are highly suicidal. The treatment of child abuse. The treatment of child abuse, we could categorize it whether the treating the immediate effects like if there is a burn or a bruise, just take him to the doctor. The fractures, just take him to the doctor. That is a first priority for us. Next, the number of the thing should be we should free the child from the abuser. Next, the long-term effects we could focus on treating the trauma, like we can do a focused cognitive behavioral therapy for the sexual abuse children, for the post-traumatic disorders, or for depression and for anxiety. And there is another category called abuse-focused cognitive therapy for the children of physical abuse. The main the theory behind it is it mainly targets externalizing behaviors and it strengthens the pro-social behaviors. And parents are also involved in this treatment to improve the parenting skills. The main important thing could be that the child abuse could be treated mainly with a parent-child interaction therapy, and this will have to improve the bonding between the child and the parent. There are many ways to prevent the child abuse. The simple support for the children and the parents is the best way. Educating the parents, involving them in involving the child in after-school activities, mentoring programs, invest in kids, encourage leaders in the community to support for the children and the family. Ask employers to provide a family-friendly environment. There are many organizations to help the victims of child abuse. The one could be National Alliance for the Child Trust Fund, NICHD, which is the National Institute for Child Health and Human Development, Prevent America Abuse. The child abuse is a reportable disease, and April is considered as a Child Abuse Prevention Month. The facts about the child maltreatment from CDC, according to the Child Protective Service, 68,000 children were the victims of maltreatment in 2012. Out of those, 1,640 children died of the abuse and neglect. The lifetime financial cost associated with just 1 year confirmed cases of child maltreatment is $124 billion. I think the topic of child abuse, and I want to emphasize how a child abuse leads to the development of many psychological and psychiatric disorders, and this is definitely a preventable one. The child should be free, playing in the sun, not living in the nightmare